Chair of PTF, honorable ministers here present, directors general, ladies and gentlemen of the press. As at this morning, the 12th of May 2020, 242 new COVID-19 cases were confirmed in Nigeria, giving us a total of 4,641 in 34 states of the Federation and the Federal Capital Territory, with unfortunately 150 fatalities recorded. 902 cases have happily been cured and discharged from care. The 242 new cases reported are as follows: from Lagos 88, Kano 64, Katsina 49, Kaduna 13, Ogun 9, Gombe 6, Adamawa 4, FCT 3, Ondo 1, Oyo 1, Zamfara 1, Borno 1, Bauchi 1, and Rivers State 1. The Federal Ministry of Health is working with its agencies and other organs of government and multinational organizations in continuous efforts to control transmission with tried, tested, and innovative measures. The nature of this outbreak, as we have observed in other countries, is such that the sustainability of any strategy may be challenged as time goes on by evolving realities at home and also across the globe. We must therefore be ready to adjust to the situation as it changes. To reduce our burden, we encourage organs of the state maintaining vigilance at our borders, including our port health services, to keep up the good work and not to tire or to relent. The Federal Ministry of Health has been closely monitoring and reviewing the unfolding situation in some states where COVID-19 appears to have gained ground. We had responded to the situation in Kano by dispatching a team of medical experts that is providing technical support to the State Ministry of Health. I am pleased to inform that the team has done very well in their assignment and has reported a lot of success in helping to stabilize the state's health system, to assuage the disquiet among health workers who are going to restart routine service delivery, particularly immunization, antenatal clinic, and so on. No new infections of health workers has been reported in the line of duty in recent times due to all the training and retraining that has gone on. And those who have recovered from their infection are awaiting certification to resume work. A Federal Ministry of Health delegation of experts is presently in Bauchi State on a fact-finding mission to work with the state government and look into reports of unexplained deaths in Azare, Bauchi State. Other high-burden areas or states grappling with epidemic control issues will be offered the same support. We have recently had such delegations visit Jigawa and Katsina State, where needs have been identified, and we are looking at ways of supporting Katsina State with a 54-gene laboratory, as was displayed today, to reduce turnaround time and waiting time. In this connection, I also wish to commend the ongoing initiative being developed by the Governors Forum to rally available human resources for health volunteers from some states to support high-burden states with manpower shortages. I'm encouraged by recent conversations with Their Excellencies, the Governors of Lagos State and Ekiti State on this subject. The Federal Ministry of Health, through NCDC, has already printed the mandatory institutional quarantine guidelines and NCDC crew kit for returnees coming in from the diaspora. As we have continued to ramp up COVID-19 testing capacity by adding 3 new molecular laboratories to our network, Benin City and 2 in Port Harcourt, which brings the total number of facilities with molecular laboratory capabilities to 25. An expert advisory team is to be set up to assist with our audit of laboratory processes with a view to offering suggestions on strategies to reduce testing turnaround time and other issues of matter of interest to users. The number of isolation centers and beds nationwide is increasing, and has already been mentioned by the chairman, with the This Day Dome commissioned in Abuja today, is providing the most comprehensive panel of medical services for COVID-19, including lab testing, ICU, and dialysis. It was handed over to the Federal Ministry of Health and the Federal Capital Development Authority, and it signals a landmark in collaboration between public and private sector to fight this common enemy. The center has wards and ICU center with ventilators, has X-ray, mobile X-ray, and it has the dialysis center. The Gene Expert Testing Mobile Laboratory is there, complete with reagents, scalable from 200 to 1,000 tests per day. It should significantly reduce the waiting time and also the turnaround time in the Abuja metropolis. A hotel and conference center was donated by another philanthropist next door to the dome for use by medical staff who are working inside the dome, and this conference center will be available for a period of 6 months. The CBN medical grant in direct support of Federal Ministry of Health and FCTA for day-to-day management of the isolation center is also on offer. There is an industrial-grade medical incinerator on site for managing medical waste. Laboratory services in this center is no doubt a great boost to testing capacity and will enhance our capacity to handle confirmed cases and reduce frustration that has been reported in this area. We shall make this facility operational within the coming days. I want to use this opportunity to thank all the donors and the sponsors of this very wonderful facility. I also use the opportunity to enjoin state governors to continue to ensure that they reach the isolation capacity target of 300 beds in every state of the Federation minimum, while also calling on philanthropists to support their state's efforts, including expanding the capacity for tracing, testing, isolation, and treatment. So I conclude by thanking all our countrymen and countrywomen for their sacrifices they have made and are still making. This is all for the good of all of us. And I also want to remind you of the injunction to wear your masks, especially if you know that you are going to somewhere where you cannot avoid crowding. If you are going to the market, or going to a public event center, to wear your mask so that if you meet anyone who by any chance is positive and not known to you or to the person, you do not become a victim. I also urge you all who are wearing cloth masks to make sure that your mask is properly washed every day and sunned or ironed to reduce the risk of transmission and retransmission. Thank you all for your attention.